Welcome to Good Health Matters. I'm Sindhu Dwamvudi, and today I'm joined by Dr. Jules Lipoff, who is a board-certified dermatologist based in Philadelphia. We're diving into what skin can reveal about your health, concerns like acne and skin cancer, and how when it comes to caring for your skin, simpler is often better. It would mean so much if you could take a moment and hit the subscribe button. It's so good to have you here today, Dr. Lipoff. Can we start by having you share a little bit about your journey, what got you into medicine, and how you ultimately decided to pursue dermatology?
Well, I don't know that I had any straightforward route. I certainly wasn't aspiring to be a doctor or dermatologist from the start, but my father is a retired cardiologist, so I had a lot of exposure to medicine growing up. And specifically, I was more interested in science and math. And in college, I worked in some research labs and found that it wasn't necessarily the best fit for me personality-wise. I wanted to interact with people directly, and I was less interested in translational work. I wanted to be clinically active, and so that led me to. I was a biochemistry major, so it wasn't random that I was interested in medicine, but I decided to apply. Stein College of Medicine in the Bronx. Did a lot of different things. I didn't really know much about dermatology at all. But I found myself really gripped by, when I did a rotation in dermatology, I was really gripped by the old school nature of it, how concrete a specialty it is. So a lot of internal medicine is percussing and palpating and trying to abstractly understand what's going on inside the body. Not so different from what threw me a little bit off in the lab, like moving one thing from one pipette to another, run that test, and eventually you see something. It wasn't as immediately concrete. But in dermatology, you can make bedside diagnoses. You can look at the patient. We did this grand rounds at Einstein with our original founding chair, Dr. Michael Fisher, where we had patients come in and we were allowed to look at them, but only ask them if it itched, hurt, or burned, and nothing else. We were not allowed to know any history. We were allowed to look in their mouths to look for a thrush to see if they might be immunosuppressed. We were allowed to, they might generally tell us the area of the body to look or their age, but we were not allowed to know any history. And we developed our differential diagnoses. And I really found that thrilling. That of course we use pathology and imaging in labs sometimes, but really being able to figure out a diagnosis without all of these contraptions and abstractions that we use.
That's awesome. Yeah, and I know that you've been involved with medical media and public education kind of throughout your career, so especially excited to talk with you today. It's often said that the skin provides a window into somebody's overall health. Can you kind of talk about that concept and what kinds of conditions may show up on the skin first before somebody even shows any symptoms?
Well, there certainly are cutaneous signs of systemic disease. That's been known, although initially when dermatology was emerging as a field, it wasn't appreciated. Actually, in the late 1800s, I think in Germany is when they created the field of internal medicine, and they named it internal medicine, actually to distinguish it from external things like the skin and surgery. So I think in some ways dermatology as the field of external medicine, they thought, of course, and for instance, we dominated the field of venereology, sexually transmitted infections. That was completely the realm of dermatologists, because syphilis can't possibly affect inside of the body. That was kind of what they thought. That was just an external problem, right? And actually, even the American Board of Dermatology was American Board of Dermatology and Syphilology up until the 70s or 80s. So just to give you a sense. But yet there's all sorts of things you can't, we have the benefit that you see all of the skin. If other internal organs were external, we probably could appreciate certain things. Common things, it's very easy to tell if someone has a tendency to seasonal allergies and eczema. Like if they have a horizontal line on their nasal bridge, it means they've been doing an atopic salute, rubbing their hand upward on their nose repetitively. So just looking at someone, I can say, oh, you have seasonal allergies. Or I can look at their palms. We can be palm readers, and I can see if there's a tendency, since they might have hyperlinear palms. there might be that suggests they have a filaggrin mutation, so they may be predisposed to eczema. So those are some common things. But nowadays, with our obesity epidemic and diabetes, we see acanthosis nigricans, which is this brown velvety plaques that can appear on the armpits of the neck. You can actually have it on the knuckles or subtle brownish changes on the cheeks. So that suggests that someone either is diabetic or has insulin insensitivity. And so that's something you can catch very early. There are certainly many other, there's all sorts of signs of cancers, collagen vascular disease, connective tissue diseases, obviously skin cancers, other things, but certainly allergic things, autoimmune things, infectious things, these are some of the most common. As far as actual skin health, I think that's probably overstated. Sometimes people are worried about drinking enough water to help their skin, and that is really an urban myth. Like the amount of dehydration you would have to make your skin affected means you have bigger problems. So I don't really make any recommendations for things like that.
Good to know. And then can you talk about the skin microbiome, why we should care about that, and if there's certain things that people may do unintentionally that affect it?
So I think this is the skin microbiome, and the microbiome as a whole is something that we are learning a lot more about and only slowly understanding. One of my former colleagues, Dr. Elizabeth Grice, who is a researcher, she had done a lot of work in this area and had a lot of respect for that. I think the truth is we don't really know. We know that when we take antibiotics, the microbiome is impacted. We know that it seems that in some people who have GI or other issues, their microbiome might be affected, but in most people, it's not that big a deal. So we use a lot of antibiotics in dermatology. It's been a point of focus for improving care. Even I think the American Academy of Dermatology made a point of trying to restrict how much we're doing because more or less we're 1% to 2% of doctors, and we prescribe roughly 10% of systemic antibiotics. And so, because we use more extended courses for things like acne and rosacea, and so tetracyclines in particular we use a lot of, but they are also very good for resistant infections like MRSA and sexually transmitted infections, Lyme, lots of things. So we have to be judicious in how we use them. I don't know about the long-term effects. Certainly there can be short-term effects, but I think it is smart that we try to not use these things recklessly and assume there is no downstream effect. But I think the jury's still out. We really don't know enough.
I would love to get into acne now. So could you go into the mechanism, like what actually causes acne?
I think most of us in the general public understand from just advertisements and such that acne has something to do with pores in our face. So what is a pore? Why the heck would we have holes all over our face? Well, they're not just random holes. They're actually each individual openings to pilosebaceous structures. So that means it's a hair follicle which is connected to a sebaceous gland, right? So there are three main components of what's happening with acne that reflect a dysfunction here. One is that the skin isn't turning over properly, so that can plug up these pores with dead skin or sebum. That also may involve the overproduction of sebum, which is stimulated by androgens like testosterone. So that happens in most people's lives in puberty. But for women, there's fluctuations in androgens every single menstrual cycle, pregnancy, and menopause. So it's quite common to be having acne, throughout one's adult life. There's also a certain amount of bacteria that's growing in the pilosebaceous unit, and that's normal. They thrive in an anaerobic environment, so there's P. acnes, Pyrrhosperm acnes, Propionibacterium acnes, excuse me. It's an anaerobic bacteria, but it doesn't thrive unless there is an anaerobic environment. So when it's closed off, it thrives. And then the third component is an inflammatory response against a foreign body. So we have the sebaceous gland dysfunction and plugging up the pores driven by antigens. We have the bacterial overgrowth, and we have the inflammatory reaction. So usually our treatments are directed. We have bacteriostatic, bactericidal things like benzoyl peroxide and antibiotics. And then we have retinoids, which are vitamin A derivatives specifically tretinoin topically and isotretinoin Accutane systemically, which can address the sebaceous gland dysfunction. And then we have things that address the hormonal issues like spironolactone, which blocks testosterone, and oral contraception. And there's more we can get into, but that's the main gist.
Are there things that people should be aware of before they start on these retinoids for treatment?
The retinoids are very drying. How they work is shrinking the oil glands. Some people, because of TikTok and social media, like to use the quote sandwich method. I do not advocate for that. I like diluting, taking a pea-sized amount, mixing it in your palm with a non-comedogenic moisturizer. That means one that won't plug up the pores. And using that every other night and working your way up to every day. Systemically, it will dry you out a lot more. Certainly isotretinoin is associated with birth defects, very severe ones, so that's why it's restricted, and there's a program called iPledge to make sure people are not pregnant when taking it. Retinoids, topically, I can't really imagine that there's any risk, like probably eating a single carrot is just as much risk, but we do recommend, just to be extra conservative, that anyone intending to get pregnant or who is pregnant not use topical retinoids.
Going back to the topic of social media, so we see a lot of product recommendations and different people sharing their experiences. And we see a lot of different skincare routines popping up. Do you have any recommendations for what an ideal skincare routine should be?
Yeah, I generally am pretty minimalistic. I think that we are in a culture with the Instagram and TikTok influencers or skinfluencers where they're really promoting stuff, but a lot of the time, especially when we see celebrities, we look at them and we think, I want to look like them. I wish my skin looked that good. I should do what they do. Mm-hmm. But the truth is, they don't look good because of the things they tell you they do. They can sell you things because they look good. They've already been selected out genetically by genetic luck to have this fortune and talent. That is not what is leading them to look good. Most of aging is genetic. At birth, it's 100%, and it may only go down to as much as 60% by the time we die. So there's always so much we can do. I think it's worth leaning in heavily into the things we know. And one is that ultraviolet light and sun promote aging. So if you're avoiding intentional exposure and wearing sunscreen, we recommend SPF 30 or greater when you're going out. That is helpful. Topical retinoid might be helpful.
Okay.
That may be anti-aging. Honestly, beyond that, it's questionable whether anything does anything. There's a lot of possible leads and low-quality data for all kinds of things. I would recommend leaning in heavily to the things that we know work rather than trying a little bit of everything that might work. Because of money, because of mental bandwidth, there's only so much you can do. We're not trying to stop ourselves from aging entirely, after all. Maybe some of these people, the type of people who are trying to take sirolimus and metformin and prevent their telomeres from changing, all this kind of stuff are working that way. But realistically, I think anti-aging is just basic things. Most people don't need to be excessively washing or bathing. A lot of hygiene, back in the day when sanitation was an issue, was very important to prevent infection. Nowadays, we're pretty clean, and so we're overwashing and overcorrecting, and probably that's part of why we have so many allergies and allergic conditions. So, it's not necessary to shower or bathe every day. Certainly, you want to bathe and clean your hands after using the restroom or after getting dirty. But I think we have made ourselves super complicated. We enjoy being complicated a lot of the time. And, certainly socially, you don't want to have body odor in our American society. In other societies, that matters less, but it's not more hygienic. I think moisturizing is only necessary if you're dry. If you're not dry, you don't need it. You may not even necessarily need that much sunscreen. Your risk for skin cancer and things is very low if you're darker skinned, although it may help prevent aging and pigmentation. I think we tend to overcorrect. We tend to want to believe we have more power over these things than we do.
For sure.
Most of it is just genetic luck, but simple things like sunscreen, retinoids. I tell people, it's great if you can do that, but actually even more important in life is never smoke cigarettes and always wear a seatbelt.
That's true. That's a good one, yeah. So you mentioned definitely sunscreen is an important one. How would you recommend people go about choosing it? Does anything higher than SPF 30 actually make a difference?
So SPF is on like a logarithmic scale. So SPF 15 is 90% protection, SPF 30 is 97, SPF 50 is 99%. So it doesn't necessarily help that much more. The American Academy of Dermatology recommends at least SPF 30. It's possible that people don't actually apply it sufficiently to be measurably that amount of SPF. So probably using higher than 30 might have some benefit to correct for that. But what's most important is finding a sunscreen that you like and will be consistent with. I think that they stopped allowing advertisement of above a certain number of SPF because it was somewhat manipulative of consumers. Because SPF 100 is not twice as good as SPF 50, right? It's just only a little bit better. I think sunscreen is important, and mostly it's about being consistent with it. I like people to use the lotions rather than the sprays. The sprays, people really aren't getting that much on themselves, and they miss areas easily, and who knows, they can inhale it. We have a new sunscreen ingredient that was just approved by the FDA, although it's been around globally for a long time. We'll see how that gets commercialized and integrated into the US.
Okay, so it's just more about how consistent we are with using it and how much are we getting it in all the places that we need to.
Yeah, I think it's less about the specific one and more about consistency, yeah.
Can we talk about why skin cancer has just become so common and what are the main types that people should really know of?
Skin cancer has always been common. Basal cell carcinoma, BCCs, are the single most common cancer in human beings. I might question whether we really need to call it cancer because it is really not life-threatening at all. There are very excruciatingly rare cases of metastatic basal cells, but most dermatologists will never see a case that metastasized or was life-threatening in their entire career. And we see a lot of them. That is related to lifetime cumulative sun. The other two main types are squamous cell carcinoma and melanoma. Squamous cell carcinoma is also related to UV radiation and can also be related to HPV infection. Primarily, we see it from the sun. And melanoma is the one that we care the most about because it kills several thousand people every year in the US. I think over 10,000. And there's been concern because the number of diagnoses has definitely gone up over the last couple of decades. One of my colleagues, Ade Adamson, and others published an article about this in the New England Journal a few years ago. So definitely the diagnosis of melanoma has gone up, but the mortality hasn't really changed, or if it has at all, it's because of the introduction of PD-1 inhibitors rather than our screening. So there's probably a lot of factors going into what you might call the overdiagnosis of melanoma. It's unclear if it's really increasing or are we just diagnosing it more. And we're seemingly diagnosing ones that are not dangerous because the mortality hasn't changed. I think there's a combination of just general awareness of skin cancer and getting more screenings. I think the way that pathologists are calling it has gotten more generous in calling things melanoma. Certainly anytime we see a patient, we're not going to dismiss it. We have to take care of anything we see in front of us. But we got to think about, are we biopsying too much? Are we screening too much? Are we overcalling it? To make sure that we're doing what cancer screening is supposed to do, which is save lives. And it's not clear that we don't know, the jury's still out about skin cancer screening, but we still need, I think it makes a lot of sense. A consensus dermatologist would say that skin cancer screening is very important for high-risk groups, but we have yet to define that. I don't know that it's necessary for a general population. Definitely, skin cancer is something we should pay attention to, and we urge anyone to come in if they notice a new or changing lesion. That's not a screening. That is a problem-focused visit. But if someone is at higher risk, which means they've personally had a skin cancer, they have a first-degree family member with melanoma, they have had extensive UV exposure, they are immunosuppressed, they have a lot of moles, meaning more than 50, they have any moles that are irregular or atypical, these are the ones that no one is really going to argue with that we should screen these people probably yearly. But we have yet to define who needs the most screening and more, because all forms of immunosuppression are not equal. So we really have to figure this out. There's a lot of work to be done. But yes, we should pay attention to it.
And that's really helpful to break down what people should be looking for. Can you talk through what actually happens with the skin exam in the office?
So a total body skin exam, skin cancer screening is done differently by different dermatologists. But generally, it's a visual exam looking at every part of the body in a ritualized, very specific way. We're looking at all of the external parts of the body. We may use something called a dermatoscope, polarize the light with a magnifier so we can look at moles and other patterns closer, better appreciate what's not apparent to the naked eye. And we're generally just looking. When I do it, I start with the hands and look at the arms and the face. I take a glance in the mouth, look at the ears and the scalp. I look at people's back. I look at people's back of their legs. I look at their underarms, their chest, their abdomen, their genitals, their legs. And we're just doing it in a way where people are, in a gown. And we try to expose as little as possible at a time and make sure we have consent to look at different parts of the body, especially areas that are more sensitive. Really, there can be specific things that we see about certain lesions, but generally we're looking for things that stand out as different from the rest. Like a lot of people have many freckles and moles. We're not going to be able to look at every single one with the dermatoscope, but we're looking for which is the ugly duckling, which stands out from the rest. And so, most melanomas are caught by patients themselves, so we take very seriously when people are concerned about something. But it's a collaborative spirit. We work together to just make sure everything looks good. But usually a typical skin cancer screening just takes a couple of minutes to look through the entire body.
It's typically like once a year, but depending on kind of family history, sun exposure, all of these things.
It depends on risk. I would recommend for those categories I mentioned before, like if you personally had a skin cancer, first degree, melanoma, all this stuff, usually yearly is what we recommend. We don't have the level of evidence to have like official U.S. Preventive Task Force guidance on any of this. It's not advised against, it's just we don't have enough data at this point. But certainly for those high-risk people, but if there's anyone of any skin type, no matter the risk, that has something that doesn't look right, that's new, that's changing, we recommend they come in.
So if somebody doesn't have readily access to a dermatologist, no problems with finding an early appointment, or there's some other barriers to access there, what do you recommend people do in the meantime to really take care of their skin health?
I think most things in dermatology can be managed by primary care. I think you can get acne and eczema managed decently by most primary care doctors, and most of those primary care doctors do know dermatologists, so they might be able to curbside if they really can't get someone in. I do think you need to seek medical care. I think that unfortunately, because of barriers to access, people are doing things by themselves or trusting social media, or sometimes using some of these direct-to-consumer apps that I think in some ways are meant just to deliver prescriptions rather than to evaluate patients, because that's their primary financial model, is making money from prescriptions. So I think it is important that you see someone, hopefully someone who has an MD behind their name.
And as we come to an end here, I just wanted to ask you if you had to share some advice to everybody who gets to watch, if there's one thing that you really recommend that they do to help their skin health long term.
I think that there's a lot of different things that people do for their skin. I don't know that you really need to do that much for most average people. Wear sunscreen when you're out in the sun at least. If you're dry, moisturize. You don't need to exfoliate or overdo things on your body. Like, your body will do it itself. I think a lot of things, there really isn't that much that you have to do. It's very personalized. If there is anything, if you have like acne, eczema, psoriasis, one of those things, certainly you need to have care directed to those issues. But in general, less is more.
Love it, yeah. So it's just coming back to the simplicity is key.
People don't make money off less is more. There's whole industries of skincare and hair care predicated on making us feel anxious about ourselves, and so that we need to purchase products in order to feel more normal. But I do truly think that we don't need that much. I think if someone finds that something benefits them, and it's not hurting their budget too much, it's a consumer luxury good. You're welcome to use that. But I at least want them to avoid things that could be harmful. Like don't take collagen pills. Don't put hyaluronic acid on your skin expecting it's going to do anything, because you do that, but it's not going to get absorbed significantly into your body. There's a lot of question the use of peptides. Really look at things skeptically. Just because someone said that something might help, a supplement or holistic thing, there are some things that are supplements and things that I'm advocating for because there's real data behind them. But I don't think you should just, it's okay to do experimental things if you've done the traditional things first and they haven't worked. But I don't think you should skip ahead thinking that there's this one little diet change or one little product from South Korea or whatever that's suddenly going to change your life. You never know, maybe you'll like it, but I think we're much less complicated than we think. And sometimes, people found this during the pandemic when they were not out and about using as much products and makeup, that they felt better. Some people referred to it as the great pause. And I think, simplicity is underrated.
Yeah, thank you so much for that advice, and thank you for this conversation. And everybody watching will get to take away a lot from all the tips that you shared.